Can you see this document? Right? You can either use them to pass your exam, or you can ignore them and fail your exam. You decide. This document is for NCLEX-RN. This document is for NCLEX-PN, and this is for REX-PN. Now, all these documents, they are called what? Test plan. Now, the main purpose of this document is for students who are taking any of this exam to see how the exam work, right? Now, the most important thing about this document is that it includes what? The content that will be tested related to each exam. Now, let's talk about content real quick. For the past 2 years, I've been coaching, right? I've been able to help 700 students pass the exam. But when I ask most of these students, most especially 80% of them that failed the exam before, right? When I ask them this one question, what did you do in order to what? Study for content? What they reply is that they got what? A question bank. They said that's all they did to study for content. Now I said, do you believe that those programs have the content related to the NCLEX? They said yes, because most people use it and end up what? Passing, right? They still reference to most especially their friends, someone they know who use the program and then end up what? Passing. Now, I'm not saying, okay, if this question bank have the content, now can you mention one content related to the exam for me? And then the student is lost. They cannot really mention a content, right? Now, let me tell you the danger of not knowing your content before you go on the NCLEX exam. Because this is the reason why a lot of people, students fail the exam, right? It's just like now, you want to cook. Think about it. You want to cook, you don't have what? Ingredients to cook. You just have your kitchen tools. Are you going to be able to cook? Obviously, no, because you are not cooking anything. So, why would you go on the NCLEX exam without not knowing your content? You are just going to gamble your exam. All right, think about it this way. You are trying to give a patient medication without not knowing the patient diagnosis. What are you trying to do to the patient? You are putting the patient's life at risk. So why are you going to go on the NCLEX exam without not knowing your content? Guess what? You are putting your exam at risk. And that's the reason why I said you can either use these documents, most especially the one that is related to your exam, or you can ignore it and fail. Because one thing I know is if you use these documents, the one related to your exam, you are definitely going to pass. Because it have everything you need to know about the exam. Now, this is why a lot of people have anxiety, or why a lot of students have anxiety, because they have anxiety due to what? The fear of the unknown. So when you know what is on the exam, then your anxiety cannot go just like that, but it's going to cut down to half. Now, let me show you how. In nursing school, your lecturer for med-surg can tell you, I want you to prepare for med-surg exam. At this point, only hearing about that exam, you have 90% anxiety. But guess what? If your lecturer not tell you, because do you know the reason why you're having this anxiety? Because you might be thinking about this. You might say, okay, there's a lot of things we need to know related to med-surg. So what do I need to focus on? So your anxiety level is high because of you are feeling what? Overwhelmed at this point. But guess what? If the lecturer not tell you, all right, I want you guys to focus on hypertension, focus on COPD, focus on MI. This is only what will be on the exam. Guess what? Your lecturer just saved you in a sense that your anxiety drop in half, and then right now your anxiety level is just 45. And the reason why your anxiety level is 45% right now is just because the next thing you want to know is related question. Because right now we don't know what question that will be tested related to what? Hypertension, COPD, MI. But guess what? Our anxiety level have dropped. If the lecturer did not tell you this, guess what? This will be your anxiety level. And your anxiety come from what? The fear of the unknown. So NCLEX understand that a lot of students have anxiety due to what? The fear of the unknown. And because NCLEX is a different environment than nursing school, that is the reason why the NCLEX provided these documents. The NCLEX-RN for student taking RN exam, the NCLEX-PN for student taking PN exam, and the REX-PN for student taking PN exam in Canada. So these are the documents you should, okay, let me just say, you need to pick out the document related to your exam, get the content, and 100% pass your exam. Right. If you are not working with your content, you are just like a nurse, right, who is trying to give a patient medication without not knowing the patient's diagnosis. Guess what? The nurse is putting the patient's life at risk. So now if you go on the NCLEX exam or you are taking the REX-PN exam and then you don't know the content, you are putting your exam at risk. Or take a look at it this way. You want to cook, but you don't have what? Ingredients. You only have your kitchen tools. Your kitchen tools cannot make you the food. You need the ingredients to make the food. So if you go on the NCLEX exam, guess what? You will not be able to do anything because you don't know the content. If you were able to do something, guess what? I call it this is what I call it, gamble. Right? You gambled your exam. Right. In reality, you gambled your exam. Right? You like, because NCLEX exam is 85 to what? 150 question. Right? Now, this is what happened. Throughout your 85 question, each of your 85 question is testing you on one client. It means that every client you gambled their life because you don't know the content. Now, let me tell you the reason why when you go on the NCLEX exam, you end up gambling the exam. The reason why you end up gambling the exam is because the approach of nursing school is different from the approach of NCLEX. Let us start talking about nursing school. Right? Let's start by talking about nursing school. Now, nursing school, the result of nursing school is knowledge. The moment you graduate from nursing school, you have every knowledge you need in order to approach any exam in the world related to nursing license, sure exam, right? Because yeah, that's what we want to do. We want to get license, right? Now, NCLEX, the result of passing the NCLEX is what? Your license. That is the result of passing the NCLEX, your license. Now, when you pass the NCLEX, you get your license. When you finish nursing school, you get knowledge. Now, nursing school give you all the knowledge you need in order to approach the NCLEX that give you the license that automatically make you what? A nurse. Right. Am I making sense? Now, since nursing school is all about knowledge, where are you developing the knowledge? You are developing the knowledge related to various what? Courses in nursing school. Because you are what? A nursing student. A nursing student what? Try to what? A nursing student try to what? Gain all knowledge related to each courses. Now, when you pass each courses, that is only where you can graduate. Right? But NCLEX is not trying to test you related to knowledge. NCLEX believe you have every knowledge possible, right, to become a nurse. So NCLEX is just saying, come and show us that you can practice related to the knowledge you have. So NCLEX don't do courses. NCLEX do practice area. Now, let it make sense. Let it make sense to you. Now, have you seen anybody saying, "Oh, I want to work in the pharmacology unit"? Have you seen anybody saying, "I want to work in the nutrition unit"? Have you seen anybody saying, "I want to work in the pathophysiology unit"? No, because those things I mentioned right now, they are courses. They are not practice area. You understand? They are not practice area. NCLEX do practice area. NCLEX don't do courses. But your courses altogether give you the knowledge in order to function in a practice area. So all NCLEX is just asking from you is to use those knowledge in order to show that you can practice. So if nursing school exposes you to courses and NCLEX is exposing you to practice area, meaning you cannot be acting as a nursing student on the NCLEX. And this is what a lot of students do. They act like a nursing student on the NCLEX. You need to act as a nurse because only nurses work in the practice area, right? Or ready to become nurses work in the practice area, but nursing students deal with courses. The moment you are trying to do your clinicals, you are a nursing student, right? But you are acting as a nurse, which is a student nurse, right? Because the same way you are going to approach your courses is not the same way you are going to approach your what? Clinical area experience. Am I making sense? Now, that is the main reason why you need to understand when you are understanding your courses. Like I said, your examiner want to test you on what? Med-surg, and the lecturer gave you the area of concentration. Same way, when you are understanding the NCLEX, yes, we know it related to practice area, but we don't know the practice area NCLEX want to test us on. And that's the reason why this document is there to tell you the practice area. Each of these documents include 8 practice area. NCLEX call it what? The writer of these are the writer of the NCLEX, NCSBN. These are the writer, NCSBN. Now, the writer of this exam, they call those area what we call the 8 client need. You can either call it the 8 client need or you can call it the 8 category. Anything you like. Now, guess what? If you fail the NCLEX exam before and you check your test report, right, you are going to see this 8 client need or 8 category listed. They are your practice area, right? If you go through them, you're going to see they are not courses. They are practice area in a sense that NCLEX want to be sure that you can practice related to those 8 areas. Now, in order to know those 8 areas, all you need to do is to get the document related to your exam. If you are taking the NCLEX-RN, get the NCLEX-RN test plan document, right? If you are taking the NCLEX-PN, get the NCLEX-PN test plan document. And if you are taking the REX-PN, get the REX-PN test plan document. Then you get access to what? This 8 client need. You are going to get access to it because that is the foundation for you in order to what? Successfully pass the exam, because you cannot go on the exam without not knowing what you are dealing with. Now, NCLEX wants you to show that you can practice related to these 8 areas, whether you are taking the RN, PN, REX, PN. Now, in order to show that you can practice related to this area, you need to know the content under each of these area. If you check your test report, if you failed the exam before, right, you are going to see that each of this area is either you were graded above the passing standard, near the passing standard, or below the passing standard. Right. Now, one thing I want you to know about this test plan is that each of these practice area, they are not tested evenly. Right. One can be 18%, another can be 16%, another can be 14%, another can be 13%, another can be 12%. Right? It means that this part, we have the most question on the exam, followed by this part, followed by this part, followed by this part, followed by this part. Your test plan is going to tell you the area that we have the most question on the exam. Now, if you can follow through the most important part of the exam and you read in that format, you will find out that you cover the most important part, which also make you succeed on the exam very well. Right? Now, since we know the practice area, which are the client need or what the categories, now we want to now know the various content we need to cover related to each of them that will make us above the passing standard. Now, if you go down this document as well too, you are now going to be seeing the the document will now start listing each of those areas. It will start with the first one, which is management of care. Then it's going to list every content related to what? Management of care. This is for RN, right? It's also the same for REX PN. Management of care is what you have what related to REX PN, and management of care is what you have related to RN, NCLEX RN. But for NCLEX PN, right? For NCLEX PN, it's coordinated care. It's coordinated care. So if you look at the coordinated care, you also find out that a lot has been listed. The content has been listed related to coordinated care. So the NCLEX is like, okay, now management of care is one of the practice area that a nurse must fulfill. It's an area a nurse must show I what competency. So now, in order to show that you are a safe nurse related to management of care, this is all we want you to know. Understand it, read it, cover each of those contents, and when you come on the exam, any question can show up from any of those contents related to management of care. And if you do well, you end up having what? Above the passing standard. Same for coordinated care. That is just a simple approach. So now, if initially you were thinking about the NCLEX exam and your anxiety level was very high, right? Very high. And now you now understand that NCLEX don't do courses. Instead, NCLEX do what? Practice area. After understanding this, you now get yourself familiar with what? Each of those practice area, right? And then you get yourself familiar with the 8 uh practice area. And when you get yourself familiar with it, you also got yourself familiar with what? The content in each of this area. Then the next thing, right, that you need is what we call practice question. Because when you have done your reading related to every of the content in all these 8 practice area or client need or category, then the next thing is to practice question. Same in nursing school, right? If you know you have med-surg exam, your examiner has given you a focus area. The next thing you are bothered about now is question. Now, remember I said these are the writer of the exam, right? Not uh, this is the writer of the exam. I mean, NCSBN, because it's just one person. NCSBN, they write the exam, right? So now this same writer of the exam that gave the content also gave out past question. They also gave out what? Past question. So now, guess what? We have what? Content. So from the writer of the exam, NCSBN, we have the content, we have past question, and now we cannot be able to what? Study. Because now all we need to now do is to know our content and practice the question. And with that, we can now be able to what? Study. Right? Now, the only problem with the content and practice question is that the content don't explain each of the content. Obviously, NCLEX cannot give you your content and start to explain it. What you should expect in each content. You need to do your reading, right? Because that is how NCLEX want to test to see that what you are a safe nurse. But now the problem right here is the practice question, because the practice question don't come with answers. And let me tell you the truth. The reason why the practice question don't come with answers is that NCLEX can change the content, but the content is still related to what is on the NCLEX test plan. So there's chances that most of those contents will repeat themselves. I have been coaching for the past 2 years, helped 700 plus nursing students pass the exam successfully. And what I have been using only is what? The content and past question. I'm telling you the truth. Now, see, when students go on the exam, they come back, they always used to tell me one thing. I saw most of those things on the past question, right? For 1 year, I've been doing this, and I observed that the past question end up 60 to 70% of the content end up still repeating themselves on the exam. The past question itself cover 80% of 100% content related to your test plan. So if you study your test plan so well, right, and you focus on the NCLEX past question, guess what? You have high chance of what? Passing the exam. I'm saying if you are doing this yourself. But if you walk through a process that can evaluate whether you are fully ready to take the exam, such as a coaching program, yes, then a coaching program can easily tell you if you are ready or not, right? Now, this is it. Now we don't have answers to the past question. So that's the problem now, right? But various experts have approached this question and they have answered it to their best knowledge. Me myself, I have approached these questions and I have answered it as well to my best knowledge. Not only I approached the question, answered it to my best knowledge, I also compared my answers to what various experts have done, right? And so far so good. When I checked through my answers, some answers were correct related to what people said, and some answers were wrong. The one that were correct, right, and were also correct with what other people have uh answered related to that question, I removed those ones aside. Now the ones that were wrong, I started comparing my answers. So okay, if I add this answer wrong, right, why is it correct in the other side, right? I looked for more information, and then I noticed that some of my wrong answer, I strongly agreed that they were correct, and so other part of my wrong answer, I easily what made the adjustment to the correct answer, right? Because I understood. So now, if you approach the past question, if you have studied your content so well, right, and you are able to research on the internet for the answers, you will find out that you can also create knowledge for yourself related to those questions. You can easily get the answers by yourself related to those questions, right? And from my understanding, from every of these past questions, because I have attempted the NCLEX-RN past question, I've attempted the NCLEX-PN past question, I've also attempted the REX-PN past question. And I noticed that from the answers, right, online, when I graded myself, at least I was not less than 90% uh passing. So I was not less than 90% here. I was not less than 90% here. And I was not also less than 90% here. Right. So since I was not less than 90%, it means that I have, to some certain extent, I believe that I have perfect answers related to the NCLEX past question for RN, PN, and REX-PN. So this is what I've been doing, right? So I guide students using what? The content which is on the NCLEX test plan, right? The REX-PN, right? And also I also guide them using the question bank, because that is not question bank related to program, but question related to the NCLEX. So I call it the past question because they are NCLEX past question that have been previously tested on the exam. Right. So that's what I use. And that's what I've been using for the past 2 years. And I've made me what? Helped 700 plus nursing students. Right. So if you want to pass the exam, right, you must use the test plan related to your exam. And if you want to fail the exam, right, ignore the test plan, right? So you get to decide which one you are going for. Either you use the test plan or you ignore the test plan. Now, but if you have a coaching program, right, that can guide you through the process, tell you what the NCLEX is going to test in each content, that way, you don't need to go through the process yourself, like struggling through the process. All you just need to just do is to just follow what the program have related to the content. Like when you are doing your question bank program, if you notice most content, when you start checking through each of these test plan, you will find out that most content are not even on the NCLEX test plan. It means that you are wasting your time in most question bank program. And that's the main reason why I tell students, if you use question bank and you end up passing, it's because you could have passed the exam without not using question bank. Question bank only, you just got a question bank to just make you feel like you are ready to pass, because most students anxiety play a big one on them. So because they are having anxiety, they have what we call fear of missing out, right? Fear of missing out, FMO. So fear of missing out. Now, because they have this fear of missing out, they easily just attach themselves to a particular question bank. They have the ability to pass. I've seen more than 17 students that I will ask them and I'll say, are you using a particular program to study? They say, no, they are not using any program. They only just reach out to me. And I'm like, wow. Because it's rare to hear students saying they are not using any program. And all these 17 students plus students who are not using program, they end up also passing the exam. So you have the ability to pass. Nursing school have done the mass work by giving you the knowledge you need to approach the NCLEX exam that will give you the license to become a nurse. So nursing school is enough. The only transition you need right now is to now understand the NCLEX. The moment you understand the NCLEX, you now have a clear direction to study and what? Pass the exam. So what you need right now is a clear direction, because one, you need to know the content. Two, you need to also have knowledge. So content plus knowledge equals success. This is what I tell my students. You can know the content. If you don't have knowledge about the content, you will fail. So if you decide to do it yourself, you only know the content. But if you don't have knowledge related to the content, you are going to still fail. But if you have knowledge, which this knowledge is what I want to give to you in my coaching program, right? This is the knowledge I want to give you in my coaching program. Because right now, in order, if you decide to go through this content, you have to be like navigating the document, trying to understand a lot of things. But I have done this understanding for you. All you just need to do is to follow a process, right? Now you have to pick those content one after the other and start now looking for relevant information related to those content. At least each of these documents have 100 plus content. So you have to now be picking them one after the other. You have to now go to the question bank, the past question of the NCLEX, and you need to start looking for the answers. Now, each of those NCLEX past question as well to have what? 100 plus question. The REX-PN as well to 100 plus question. So you have to start looking for the answers. But you are just using one, what are they calling it? One question bank, one past question and one test plan that's related to your exam. But you still need to go through this process yourself. You get overwhelmed again. And the whole goal is that you don't want to be overwhelmed. Because if you are overwhelmed in a certain process, your concentration level reduce. You don't want to be like that. That is the reason why you want to get yourself into a program, not just a program that is just going to throw a lot of information on you, but you need a program that can walk you through the process. You don't need a program that just throw information on you and you end up figuring it out yourself. You need a program that walk you through the process, which we call a coaching program. So you need a coach. So if you are somebody that you need a coach, if you are somebody that procrastinates a lot, right? You need a coach, somebody that can push you. If you wake up in the morning and you feel like not doing anything, right? You need a coach. If you are missing a certain information and you need clarification, you need a coach. If you have been failing and you don't know what to do next, you need a coach. Not just a coach, somebody that have gone through the process and passed, right? Someone that have gone through the process and passed. You understand? So I understand how the exam work and I can be able to help you in order to succeed. And that's why I created this complaint, right? In order to be able to help you pass the exam successfully, even if you have failed multiple times. Even if you have failed multiple times, you still have the ability to pass. It's always these three things. Anytime students come to me and they tell me, oh, I failed the NCLEX exam, I don't know what to do. They always have this problem. Either they don't know the content, they don't know how NCLEX write the question, or they don't know how to understand and break the question. It's always these three things. The moment I can fix these things with you, you are 100% going to pass the exam. Nothing is stopping you from passing the exam. I just need to figure out what is holding you back. Most especially, it's always these two things that's holding students back. The moment they can fix these two things, understanding become a process that they can easily navigate. Right. So let us fix these things together, right? Because most of the time, somehow in life we need somebody, right? If you are sick, you need a doctor. Imagine you wanted to become a nurse. You needed nursing school because this is your journey. A point whereby you were thinking of what? Becoming a nurse, right? You cannot just skip the process and just become a nurse. You need your nursing school program. You need to pass the NCLEX, right? Before you can become a nurse. You cannot say you don't need the NCLEX, you don't need a nursing school program. You need it. Same way with passing the exam, right? Some people can easily pass the exam themselves, and some people can they just need somebody to support them. They just need somebody to just guide them through the process. And it's an investment that worth it. If you ask me, right, it's an investment that worth it. Because the little investment you put down now, right, give you a career worth 50K to 70K a year worth of salary. Right. So it's not about the money, it's about you saving your time. A lot of students have failed their exam 7 times, 8 times, and in between those period of time, you need to wait 45 days. You still need to maybe study for another 60 days. Time is wasting, whereby a lot of people are already making money in the field. A lot of people are already doing what they love to do. but you are still struggling in this process. But if you can make one-time investment, make one-time commitment, and this help you to go to the next level, is that not worth it to you? Right. So if I can show you a better way to pass the NCLEX exam, right, in my coaching program for 60 days, right, and all you just need to just put down is $497. Is this worth the transformation to you? What is nursing to you? Right. So if nursing mean a lot to you and you are struggling, you don't know your way out, and you need somebody to walk you through the process, right? A structure, because you need a roadmap, you need a clear structure, right? You need everything. Like I said, the first thing you need is content, right? After content, you need the knowledge. After the knowledge, then you need what? Strategy. All these three things give you what? The ability to pass. If you have the content, the knowledge, the strategy, you will pass. Right. So let the price not hold you down from joining a coaching program. If paying $497 is a problem, I'm still going to offer you payment plan, in a sense that all you just need to just put down is what? $250, and tell me when you're going to pay the rest. Because I want to make sure I give you this transformation. What matters to me is this transformation. I hate seeing students struggle, right? I want to see you pass. We have one thing in common. You want to pass, and I want you to pass. I need your result as well too. I know about a lot of students that, remember I said I've helped 700 plus students to pass the exam. Let me tell you the truth. I have seen many students that have given up. It means that at the end of the day, all the investment is lost. Imagine a particular student who spent 28,000 US dollars in a private nursing university, and she failed the NCLEX exam 3 times, and that was it. She had to restart the whole process again. So this $28,000 investment is wasted, and she could have avoided that for just this small amount of money that we guarantee her, because I'm here guaranteeing you the transformation. You cannot go through this unique process the way the NCLEX want you to understand the exam, because that's what I'm trying to put you through. I'm trying to put you through in a way the NCLEX want you to understand the exam. You cannot go through this process and tell me you will fail. It's not possible. You cannot fail. It's not possible. What I just need from you is to do the work. If you are willing to do the work, you are ready to go through the process, do everything each day for 60 days, you are definitely going to pass. You are definitely going to pass. So, right, give yourself this new belief. You have the ability to pass. Right. So say this. I'm going to pass. Right. Say this multiple times. I'm going to pass. I'm going to pass. I'm going to pass. And definitely you are going to pass. You are definitely going to pass. Right. And it's not just by saying it, it's about doing the work. Right. So if it's you doing it by yourself, it might be a problem. But trust me, we are doing it together. I will not give you a chance to procrastinate. You are definitely going to do what you need to do. I'm that coach that is going to push you, make sure you do everything possible in order to pass the exam. Right. So let's write your story together. Right. And I will be so glad to be part of your story. So if you are struggling with the NCLEX exam, you need an NCLEX coach to help you to pass. I want you to reach out to me. Right. Text me right now. +1 767 613 0769. So reach out to me. +1 767 613 0769.